If you're over 50, this is something you really need to understand. Because what's happening inside your arteries right now might not show up in your tests until it's too late. I'm going to show you something most people completely miss, so watch this carefully.
Millions of older Americans start their morning the exact same way, swallowing a handful of vitamins to protect their health. But for a massive number of them, one specific, highly trusted daily supplement is quietly raising their risk of a stroke. High-dose vitamin B12 creates a specific hazard when it interacts with two common prescription medications taken by more than half of all people over 60. Take Harold, a 67-year-old retiree. He managed his acid reflux, took his daily B12, and passed his physicals. Yet one Tuesday morning, while making breakfast, he suffered a sudden stroke. Harold's routine checkups looked at the wrong metrics, missing a silent chemical chain reaction building inside his arteries. A major study published in the Journal of the American Medical Association found that seniors taking high-dose B vitamins over an extended period actually showed an increased cardiovascular risk under certain conditions. Most physicals only measure total cholesterol and your overall blood level of B12. When those numbers look normal, patients get a false sense of security that their morning supplement routine is working. Having a high level of B12 floating in your blood does not mean your body can actually use it. Those high numbers routinely mask a dangerous biological bottleneck forming further downstream. The first bottleneck is created by metformin. It is extremely effective at controlling blood sugar for type 2 diabetes. But over several years of use, metformin degrades a vital stomach protein called intrinsic factor. Intrinsic factor acts as a biological delivery vehicle. Think of it as a taxi. B12 gets into the taxi and is safely transported from your digestive tract into your usable bloodstream. Without it, the B12 is stranded. The second bottleneck comes from proton pump inhibitors, or PPIs, commonly prescribed for acid reflux. To separate B12 from the food you eat, your body requires a highly acidic environment. When you eradicate that acid with a PPI, the B12 remains trapped in your gut, unable to be absorbed. When a routine blood test shows low B12, the medical reflex is to recommend a supplement. Patients typically grab a bottle off the pharmacy shelf and start swallowing massive 1,000 to 5,000 microgram doses, assuming more is better. Because the body's primary absorption machinery is broken by these medications, that massive influx of B12 cannot be processed correctly. It floods the system, creating an erratic and highly toxic processing environment in the blood. This B12 blockade triggers an immediate crisis with a naturally occurring amino acid called homocysteine. Normally, your body uses B12 to convert homocysteine into something useful and clear it out. When the B12 is locked out, the homocysteine rapidly builds up. Unchecked homocysteine attacks the cardiovascular system, acting like sandpaper, aggressively scraping the delicate inner walls of your blood vessels. Researchers at Harvard Medical School note this chronic abrasion inflames the arterial walls. The constant scraping forces flexible tissue to stiffen into rigid, crack-prone pipes. Inside this stiff, inflamed environment, dangerous plaques easily embed themselves. Because the walls are damaged, these plaques are highly unstable. They break off, travel through the bloodstream straight to the brain, and cause severe strokes. Clinical data from the Mayo Clinic shows that elevated homocysteine is a primary culprit behind what doctors historically dismiss as cryptogenic or unexplained strokes. When this B12 absorption cycle breaks, it creates a physical vulnerability in the vascular system that standard imaging often misses. You should absolutely keep taking B12. Abandoning the vitamin entirely creates a true deficiency, which guarantees severe nerve damage and rapid cognitive decline. Consider a patient named Beverly. She felt perfectly fine and walked her dogs every day. But 14 years of relying on a PPI drove her homocysteine levels to 31 micromoles per liter, more than double the safe limit. By altering her B12 protocol, Beverly dropped her homocysteine down to a healthy 17 in just 90 days. Arterial health can begin to stabilize in as little as 90 days, once you supply the specific form of B12 the body actually uses. Step 1. Change the tests you request. Ask your doctor to stop checking standard total B12. Instead, explicitly order separate lab panels for active B12 and homocysteine. The Cleveland Clinic explicitly warns that homocysteine testing is a critical requirement for adults over 60, yet it remains heavily ignored in standard checkups. Step 2 involves checking your supplement bottle. Most cheap supplements use cyanocobalamin, which requires complex conversion steps your gut can no longer perform. Replace it with methylcobalamin. It comes pre-activated, bypassing the gut blockade entirely. Step 3. Manage the dose. Target 250 to 500 micrograms. Combine it with B6 and folate to clear homocysteine, and take it at a different time than your medications. Armed with the right testing, the correct vitamin form, and smart dosage timing, you have the exact tools required to dismantle this chemical trap. You can protect your arteries and secure your cardiovascular health.
Now you understand what's really happening, not just on the surface, but deep inside your arteries. And this is where most people get it wrong. They focus only on what they see in their blood tests, while ignoring what's happening over time inside their body. Your body doesn't break down overnight. It changes slowly, silently, day after day. Small habits, repeated every morning, can either protect your heart or slowly damage it without you even realizing it. And the truth is, it's not about doing something extreme. It's about understanding what your body actually needs and avoiding the mistakes that most people don't even know they're making. Because once you understand the process, you're no longer guessing, you're making informed decisions. And that's the difference between reacting to a problem and preventing it before it ever starts. If this helped you see things differently, then stay with me, because I'll continue breaking down complex health topics into simple, practical ideas you can actually use. Your health is built daily, not in emergencies. If you watched this video all the way to the end, I truly appreciate it. Make sure to like the video, subscribe to the channel, and leave a comment below to share your thoughts or questions. Your support really helps me continue creating content like this and reach more people who can benefit from it.